Yeah, so hi everyone, welcome to our first aid workshop. The aim of this course really is just to equip you guys with knowledge and information on how to deal with different emergency situations. So as like a first response. So for today's session, we're going to cover primary surveys, managing unconscious patients, CPR, recovery position, and choking. Also just a disclaimer that this course isn't certified, but we've done a lot of research and we have got trained and experienced people that are going to be teaching the course. If you do have any questions, just please leave them towards the end of the chat, towards the end of the call. You can also chat them in the chat box and we'll answer them towards the end. Yeah.
So if you do have any questions that pop up kind of during whilst we're talking, if you just make a note of them, so just direct them to the host, and then at the end of the call, what we'll do is we'll go back and we'll answer any questions. And it's also just a good way to kind of reflect back on what we've spoken about and like jog all our memories on everything.
Yeah, and as I said, this is being recorded and will be uploaded to our YouTube channel. Our YouTube channel is called the Dnipro Medical Institute SU. We'll send a link out in the email anyway. But yeah, so we're going to get started.
We're just going to start off by just sharing our screen. So bear with us one moment just whilst we do that. Let me just get it.
Yeah. So yeah, as I said before, we're going to go through primary surveys, so Dr. ABCs, managing unconscious casualties. We're going to have some demonstrations. We're going to do CPR and recovery positions, choking, which we're going to have demonstrations as well, and then we're going to answer some questions.
Okay, so the primary survey that we're going to basically start with is, so essentially what you do when you initially get to an emergency situation. So you are a first responder, so all the things that you kind of need to take into consideration. So a lot of you might have heard the mnemonic. I know there's various ones used in many different countries, but the kind of universal one is Dr. ABC or Dr. ABCs. And basically each one just corresponds to a different kind of checkpoint that you should just tick off as you're going through and as you get to an emergency situation where a person or people need you. So the first one is D, which is danger, R, which is response, A, which is airway, B, breathing, and C, circulation. But we're going to go through them in much more detail just now.
So danger. So with danger, you want to make sure that before you approach your casualty, you want to make sure that the surroundings are safe. So in certain situations where, like, if there is a situation of a drug overdose, there might be needles around where you can get injured. If there's a car accident, there might be broken glass. So you want to make sure that you yourself are not putting yourself in danger, and you don't want to become a casualty, because if you're casualty, then you can't really give any help. Also, like if there's a situation of a stabbing, the attacker might still be present. So you want to make sure you're safe first before you try and provide any help.
It is it's a common sense kind of thing, because obviously when you approach an emergency situation, you kind of subconsciously take in a lot of information when you initially get there. So we're not saying that you would get there and say, okay, I need to do my Dr. ABCs, oh, danger, and do you know what I mean? You would kind of subconsciously do a lot of these things anyway, but just kind of bearing in mind that in specific instances, for example, drug overdoses, watch out for needles, watch out for uneven floor surfaces, etc., etc. Just be vigilant. So the next one is response, which is basically your patient. So being able to kind of understand whether they are conscious or unconscious, so whether they're responding to you or not, and that will really direct what your next move is going to be. So what you would do in this kind of situation, again, it's more of a kind of a common sense thing, what you would initially do when you approach the situation and the patient. So you're going to introduce yourself, you're going to try and kind of engage them, so prompt them to speak, prompt them, ask them what's happened, ask them if they're in any pain. If the patient is not responding to you verbally, if they're not moving, you need to try and engage them physically then. And what you would do is like try and shake their shoulders. Again, keep trying to speak to them all the time. And you want to kind of think of APVU. So
you want to think that if the patient's alert or not. So if they are responsive, if they can respond, they may tell you that their shoulder's hurting or they've got pain somewhere. Responding to voice, so when you ask them questions, they can respond to you like, what's your name, what's happened to you, or whether they're completely unresponsive. So that's even to different stimuli, because there might be a situation where the patients are seem like they don't have response, but they are conscious. So they'll like move their eyes, they can move their hands. Because in some situations, people generally have shock and they can't speak, but just because they're not responding to your voice, it doesn't mean they're necessarily unconscious.
Yeah. And yeah, so the next one is airway. So this is just, again, a very quick thing. You want to just check that the airway is completely open and clear, so it's not obstructed. As you can see from the little diagram there, and we're going to do a demo of this anyway, so I'll show you there as well. You want to make sure that what you would do is just tilt the head kind of slightly back so that you're allowing the airway to be completely unobstructed. Now, if the patient is unresponsive at this stage, again, you would need to move on to the next stage as a matter of urgency. So really, really quickly.
So yeah, your next stage is breathing. So you just want to check that the patient is breathing normally. So how you do this is you kneel down next to your patient, you place your ear against their mouth and listen for their breathing. Sometimes you may not be able to hear breathing, but you can feel the breath on your cheek. You also want to make sure your head is positioned facing down towards their body. You can see whether their chest is moving up and down, because that'll be a sign that they are breathing. If there is a case where the patient is unresponsive and not breathing, then you want to call emergency services straight away and start your CPR.
Mm-hmm.
Yeah.
And then the last one that you would take note of from your Dr. ABCs is circulation. So it's basically referring to whether the patient is bleeding or not. And so whether they're bleeding, and then whether, how severe that bleeding is. So if it is quite a severe gushing wound, your priority right there and then is to control the bleeding as much as you can in that moment. And the best way to do that is to apply as much pressure to the wound. Some people use whatever you can to kind of like obviously absorb as much of the blood,
like a tea towel or a t-shirt or something.
Mm-hmm. And then if at this point they are unresponsive but they're breathing, you would put them in the recovery position and then call emergency services. We're going to go into that in much more detail, especially regarding recovery position and unconscious patients, which leads on to our next.
Yeah, also in terms of bleeding, we will have another session later on where we'll talk more in depth about severe bleeds. So yeah, managing your unconscious patient. So signs that your patient will be dropping into unconsciousness is that they'll have slurred speech, rapid heart rate. They may not be able to respond to stimuli. They'll have confusion and dizziness. So like causes, they could be in a car accident. They could have had a blow to the head, or like drug overdose or poisoning. It could be that they're fainted because of low blood sugar or hyperventilation. So you just want to look out for these signs when you're assessing your patient.
And then in terms of what you would do with your conscious patient is you need to kind of, first of all, again, check the breathing. You need to know what level their breathing is at and whether they are breathing or not. And then at this point, you prepare to perform CPR. We are going to go into more detail in a few moments. So, however, if they are breathing at this point, but they're unconscious, there is something you can do, which we're going to demo in just a moment. And what you essentially do, you just raise their legs, and by doing that, you encourage the blood flow to the brain, and you're going to try and prompt them to regain that consciousness by doing so. So usually, in a lot of cases, patients do regain consciousness after doing that if they are breathing after about a minute. If that doesn't happen though, then you would really need to obviously go on to the next steps. If there's some certain signs to watch out for as well, like I said, breathing, coughing, moving, etc. If none of those signs you can see, then you would immediately begin CPR.
And ring emergency services.
Yeah, and ring emergency services. However, it's really, really important to remember, is that if the patient's not breathing at all from the start, so they're not breathing and unconscious, you want to then immediately begin your CPR after calling the emergency services.
Yeah. So we're just going to do a demo for you now.
Yeah, just give us a moment.
Okay.
Okay, perfect. So Bilal is going to be our patient, and I'm going to demonstrate the Dr. ABCs. So all the kind of things that I would... Okay, bear with me one moment. Just making sure you can all see everything clearly. Okay, fantastic. Okay, so this is our patient. He was, let's just say, he was trying to hang up those plants in the corner. He's had a little bit of a fall, and he, at the moment, I've just come onto the scene and I'm just kind of like looking around the area, just to kind of like scope everything. Now, everything around him mainly looks clear, so I can have kind of good access to him. However, I do need to kind of watch out for little details and things like that. So yeah, you might notice there is a knife on the floor. So obviously I'm going to move that out of the way. I know this is dramatized a little bit, just to kind of prove the point of just watching out for the area, etc. So I'm going to move that out of the way, make sure that I can kind of get good access to him, etc. And then after that, I want to like basically make sure that he's responsive. So I would say, hi, my name's Zahra. You know, are you okay? What's happened, etc. At this point, he's not responding to me. I don't think out of choice, maybe. And so I'm going to assume that he's unconscious at this point as well. So, okay, so in my mind now, I've come onto the scene, he's unconscious. Okay, I'm going to go on to the next step. Right, I need to now make sure that his airway is completely clear. So I'm just going to come around so you can see. Bear with me one moment. So do you remember how I was saying about like the tilting of the head? So what you're going to do is just place like just 2 fingers or just gently just under his chin, and I'm just going to lift that back and then just pop my hand on his forehead and just tilt his head forward. And now this is a very cooperative unconscious patient, because you just kind of like tilt your head forward. Oh, you're perfect. So if it was like that, that would kind of indicate that his airway isn't sufficiently kind of unobstructed. So now by doing that, we've kind of created that nice right angle there. His airway should be completely unobstructed. And then we're going to go on to the next one. So we've done our danger, response, our airway. We're going to go on to B, which is breathing. So I need to figure out, okay, so he's unconscious. Now, to what extent is his breathing compromised, if it is at all? So at that point, what I would do is I would just lay my ear to his mouth, just to hear and see whether I can obviously hear or feel and listen to his breath as well, which I've already said here. And at this point as well, what you do is you want to kind of look down the body and you want to assess the chest area, and you want to look to see if you can see the up and down motions of the lungs expanding, etc., and the chest expanding, which would indicate that he's breathing. This can be a little bit difficult sometimes on some patients. It really depends on how kind of a massive kind of things, the shape, sizes, and age of patients. Some patients are really shallow breathers, so the little kind of up and down movement of the chest can be really hard to see, which is why people say generally stay down there for about kind of 10 seconds or so you can really monitor that chest movement. And so super obvious, the chest is like very clearly expanding, so the patient is definitely breathing. And my patient is breathing, so that's fantastic. And then lastly, I would kind of check for circulation. So that is the one that's kind of related to wounds, to severe bleeding, etc. So let's say in this particular case, there was a knife on the floor. He was trying to hang something up. He was like trying to cut something up there, and he's fallen down. Maybe he cut himself. So say he's got a wound here, what I would do is, if I had like a tea towel or something like that, probably should have had a tea towel handy, apply a lot of pressure to the wound as much as possible, and then you kind of go on to the next steps. But yeah, so our patient, we've ascertained just from doing that Dr. ABCs, is that he is unresponsive, unconscious, but he is breathing. And in this particular case, he did have a wound, so we applied the pressure. But yeah, so the kind of whole process of the Dr. ABCs is fairly quick. It's not a kind of a really long, extensive, exhaustive procedure. A lot of the things you would kind of do subconsciously anyway, but it's just really, really important prompts to initially what to do with that patient, to ascertain exactly what your next steps are going to be and how you're going to help the patient in the best possible way. Okay, and then, so we know our patient is unconscious, so we're going to now manage this unconscious patient because he's unconscious, but he's breathing. So we're going to try and see whether we can regain some consciousness in him. So what we're going to do is you would raise his legs about kind of 12 inches from the floor, again, to try and like encourage that blood flow. So I've got a little washing basket here. I'm just going to pop that here, try and get this kind of as best as possible. So you can just make your legs. Such a cooperative unconscious patient. And then, yeah, I'm just going to raise his legs like that, just up there, and this one as well. And I mean, ideally, probably, I think that's a good height, actually. It's about 12 inches, and maybe a little bit higher. But yeah, so you would leave the patient like that for about 1 minute. Once they get to this point, though, you do want to make sure that you kind of loosen any restrictive clothing, so any belts, bands, anything that's really tight, because you want to encourage the ease of blood flow as much as possible to the brain, because you were trying to encourage oxygen to the flow to the brain at this point. But yeah, oh, he's conscious, fantastic. Okay, so we're going to go on to our next section. So we're just going to share our screen again. I hope that was helpful for everyone.
So yeah.
Yeah, fantastic. So so we mentioned CPR earlier, and we're going to just talk a little bit about we're also going to do a demonstration of CPR, but we're just going to talk a little bit about the kind of situations in which you would use CPR. So you would mainly obviously use CPR, or cardiopulmonary resuscitation is used in situations where the patient is unconscious and not breathing, because you're trying to encourage them to breathe. And to watch, like I've not administered CPR in like an emergency situations, only like in practice, etc. But I have seen it done, and it's a very like vigorous kind of procedure. It can look quite kind of scary, because the amount of force you have to kind of put on the patient is quite a lot. But you're basically trying to stimulate the breath. So we're gonna demonstrate that after. But kind of put a little note on here as well. So there's two main types of CPR. So you've guns only CPR, which is where you only use your hands, and then you've got CPR with recovery breaths, which is also known as mouth to mouth.
Yep.
It's not as commonly used anymore. However, if it is used, the advice is that it only should be used if you are fully trained, and then also completely confident administering it.
Yes, because in normal cases, regular hand CPR just as effective.
Yeah.
So that's fine to do.
Yeah, and then we're also going to demonstrate recovery positions. So don't worry, we're not going to read all this out to you. This is more really for your reference. We are going to send you these slides as well, by the way.
But one thing to do note when you are choosing like recovery position is that if the patient does have spinal injury, you don't want to move them at all. So signs that the patient would have spinal injury would be like they'll be complaining about pain, particularly in their back and neck. They might complain that they can't move their limbs, or that they're having numbness. So in these situations, you really don't want to move your patient. You want to call emergency services and just wait until they arrive. And then with choking, there's two types of choking you'd have. You'd have mild choking, and this is when the airways are only partially blocked. So in this situation, the patient can usually speak and cough, and in that situation, they'll usually be able to remove the obstruction themselves. So all you need to do is encourage the patient to cough in order to clear the blockage. And if this doesn't work, then you want to move to blowbacks. So with a severe choking situation, that's when the airways are completely or mostly blocked. And in that situation, the patient won't be able to speak, they won't be able to breathe or cough. So what you want to do is you want to start blowbacks. So in that situation, you'd stand behind the patient, you'd lean them forward. With one hand, you'd support the chest, and with the other, you and give 5 sharp blows in between their shoulder blades until they remove the obstruction. If that doesn't work, then you want to move on to abdominal thrusts or Heimlich. So you'd stand behind your patient, you'd put both arms around their waist, make a fist with one hand and place your other hand on your wrist. Then with one motion, you'd go pull sharply inwards and upwards and repeat this 5 times. If that doesn't clear the obstruction, then you want to call the emergency services immediately and then repeat the cycle. So you do 5 blowbacks and then 5 abdominal thrusts and 5 blowbacks and 5 abdominal thrusts until the ambulance arrives, until they clear the obstruction. So for choking, we've actually got a cool video that we want to show you. 1 second, sorry.
And then
how do I screen share?
That one. Just added some technical.
We're not very tech savvy.
Bear with us.
Screen share.
And yeah, we want that one, don't we? So.
Yep.
Okay.
If you think an adult child is choking, ask them, are you choking? Cough it out. If they are coughing, encourage them to continue, as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand.
Sorry.
Bilal's just trying to get the best policy for all of you. Let's just hope my internet can take it.
Oopsie. Bear with us.
Just bear
with us. And to give up to 5 sharp blows between their shoulder blades.
Oh, it seems like it can.
We're just going to go back to the rubbish quality.
Yeah, and that'll work better. Sorry about this, guys.
We'll send the link for these videos anyway, so you can watch them in your own time.
St. John's Ambulance has like absolutely brilliant content regarding first aid, so we're going to link it all in the PowerPoint and we'll send it all out to you.
Yep.
Let's hope this works now.
It's going to work.
Then check to see if there's anything in the mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist. Grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they are not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking.
So that was a quick video. I hope that was helpful. We're now going to demonstrate CPR. So we're going to use a pillow. To make this a bit more interactive, if you all grab pillows and you can follow along with us. Yeah.
Oh, let's hope that doesn't fall.
So yeah, if you want to grab a pillow.
Yeah, that'd be fantastic. We'll just give you
or if you want to just watch them, that's
to grab
fine
a pillow.
also.
Or just take 2 minutes just to Yeah, okay, so we're using a pillow because CPR is like so intense and so invasive. It can actually cause damage, but the damage can kind of far outweigh, obviously if somebody is not breathing and is unresponsive, then the damage outweighs
the benefit outweighs the damage.
Yeah, that's what I'm trying to say.
Yeah, so when you start, so if our patient's head's here, when you start your CPR, you want to aim for the middle of the chest where the sternum is. And Zahra's going to demonstrate what to do.
What you would do is you would interlock your hands like this. And then you want to kind of put your hands on the sternum or the breastbone, and then you want to kind of push down quite hard and like firmly. And I'm not just using my arms to kind of like give that motion. You want to literally use your whole body weight, so as much as you can. And CPR can be quite tiring to administer as well. So you would do that, and the kind of recommended guidelines say that you would do that for about, you would aim to get 120 chest compressions in within a minute, which is obviously like a really, really, really fast rate. And then also, like it's a lot of energy you're expending. So, you know, it's a quite intense kind of thing.
You also want to aim to go about 5 or 6 centimeters down.
Yeah.
So that's the kind of force you want to do. So if you keep your arms straight when you're doing this, it's easier to put your whole body into it rather than just using your arms.
Yeah. And then what you would do as well, so you would be able to do them in like sets. So you do like, you do like sets of 30, like that. And then, yeah.
So in between, if you are trained and you are doing rescue breaths, you do your rescue breaths after your 30. So you do 30 chest compressions, followed by 2 rescue breaths, and then 30 chest compressions. But again, if you're not trained, the chest compressions are very effective anyway, so you wouldn't really need to do. Here,
Fantastic.
So yeah, now we're going to demonstrate the recovery position.
Yeah, so we're just going to really quickly do that. There for a moment. Okay, so recovery position. I remember when I was taught first aid, actually, one of the instructors said when you're first like doing the initial assessment of the patient and before you put them into recovery position, what you should watch out for is check their pockets for kind of like sharp items, because especially if the patient is unconscious and things like that, it can obviously cause a lot of damage. It can be very uncomfortable for them when they regain consciousness. Just in general, if they are conscious but not able to move and they're able to feel pain, it just wouldn't be very nice for them, especially if you had something particularly sharp and you don't know what kind of situation this patient's in, etc., to be resting on it or lying on their side on a particularly sharp object. So I thought that would be something useful to kind of make note of. So Bilal doesn't have any sharp objects on him, I don't think, I hope. And then, yeah, so just before we start as well, remember what we said about spinal injuries. So you would never put or move anybody that you suspect of having a spinal injury in the recovery position, because you could cause more damage or do more damage than good. So you really want to like make sure that your patient, you don't suspect any of those things that Bilal discussed about spinal injuries. However, I think Bilal is fine. I don't suspect any spinal injuries. So what I'm going to do is, so the first kind of thing is you would move the arm. So you move the arm closest to you at a right angle. So you just get that like that. And then we get his other arm and we get the side of his hand, and we just want to kind of cup it against his face like that, so that when we do kind of roll him over on his side, he's not got his like bare face basically to the ground. And so we just do that and we kind of hold that hand there. Now, just so you can see what I'm doing with the leg, I'm not going to keep my hand held there, but you get the idea. And so with his leg, the leg that's kind of furthest away, I've just raised that up like that. And then what you want to do, you just want to kind of cup everything and then guide it slowly and then pull his body towards you like that. Fantastic. And then again, make sure that the airway isn't obstructed, just like we discussed before. And yeah, So in this kind of position, he's safe. If he needs to vomit, he's got kind of a clear passage to do so. So gravity can basically do its work, etc. Any fluids that he needs to excrete, he's not going to choke on it. That's your priority, basically, making sure that he's in the safest position in that case. And I think that concludes the demo. So I hope that's been useful.
So yeah, that actually concludes our whole. That concludes our whole workshop for today. We will be taking questions. If you guys have any questions, just write them in the chat box, and then we'll try and answer some.
Okay, just bear with us one moment. We're just going to see what questions we're getting through. Bear with me one moment.
We do have questions about hemorrhages, but as I said before, when we talk about severe bleeding, there's 4 sessions. In the 4th session, we are going to talk about severe bleeding. So hemorrhages and stuff like that will be covered then.
Yeah. Someone made a really, really good point about if the patient's deaf and not forgetting to pinch the person's ears. So we were actually discussing this before. We were saying there's so many different situations. So with elderly people, for example.
We actually had a question about what considerations would you have if you had an elderly patient or pregnant person. So for like we said, every situation is different. So with an elderly person, they're more prone to injuries because obviously they have more fragile bones. So they're more prone, if they have a fall, they're prone to spinal injuries. So you want to take that into consideration when you do recovery positions. If you're moving your patient, you want to take into consideration that the elderly people are fragile. So you want to move them kind of slowly, kind of support them a bit more with the movements. And then for pregnant patients.
Yeah, pregnant patients. In regards to CPR, nothing would really change because, again, the benefits outweigh the damage that would be caused. However, when you're placing a pregnant lady in recovery position, you want to make sure that you place her on her, or you pull her towards on her left, because this encourages the blood flow, sufficient blood flow to the baby, basically.
Yeah.
So just remember that pregnant women, recovery position to the left.
We had another question about what would happen if you can't access your patient. So, in situations like this, it could be if there's a car accident and there's so much rubble on the ground, or they're stuck in the car, or maybe there's a building collapse and you can see the patient, but you can't necessarily access them. So what you do in that situation is you try and get response. If you can see a patient, you try and get response for them. So you speak to them, you ask them questions, ask if they're all right. The basic aim is just to get the most information possible so that when you do ring the emergency services, you can relay that information and then they'll know how best to proceed the situation. You want to use verbal stimuli, visual, what you can see. If you can see that the patient's bleeding, then that's something you can relay also. And then I think we'll take one more question.
Yeah. Haroon. That's exactly what I mentioned before. Really, really good point as well. I think something that people miss is sharp objects. So just a quick scan of the patient's pockets. It's so quick to do, but it's so easily missed as well.
We did have a question about CPR and whether CPR can cause damage, but I guess as we mentioned before, any damage that CPR, CPR can cause broken ribs in certain situations, but any damage caused is outweighed by the benefits.
You have to kind of consider when you are doing CPR, the reason you've got to do it is because presumably that patient does not have a pulse. So clinically, they're considered dead.
Yeah.
So anything that you do at that point, you surely you're trying to ensure the survival of this patient. So any damage would hopefully kind of be justified.
Yeah.
Yeah.
So that concludes our session for today.
I hope you all found it useful. I hope you all found it useful. And this is our first session. So if you have any kind of feedback, any positive or constructive feedback for us, that'd be amazing. We're still kind of learning how to relay these sessions, work Zoom and relay them effectively and stuff. So I really, really hope it has been useful for you guys.
But as I said before, this is recorded. So if you did miss anything, or if your friends wanted to watch, you can subscribe to our YouTube channel, which is the Dnipro Medical Institute SU. We'll also make a brief information leaflet with everything that's been covered today, and we'll send that out by email. That's really it. Yes. Thank you guys for joining.
So we'll end
stay safe.
Stay safe, stay healthy.
Thanks. Bye.